Hey everybody, Christy from Happy and Healthy TV with you guys here tonight to do another documentary of 100 Days of a Girl with Lyme. Today we're on day 24, and I wanted to highlight two different articles for today. The CDC agrees to add a disclaimer to Lyme disease case definition, so that's interesting. This was posted by WebWire and several other Lyme disease support groups, so I wanted to run through that. And then secondarily, there's a really interesting account on the mighty.com, which is a really great blog for those with Lyme and chronic illnesses that kind of just gave an overview of what it's like to have Lyme disease. And then finally, I have a really cute picture to show you guys, or just a picture that kind of just promotes giving information about disability awareness with Lyme. So, red-faced me, I kind of like match my purple dress right now. Spent a little bit too much time in the sun over the past couple of days, needed my vitamin D. We'll go ahead and read these to you. So, first thing is the CDC agrees to add again that disclaimer to Lyme disease case definition. So, this is interesting. I'm going to say it's a step in the right direction, which is great. Lyme has been getting a lot of publicity lately. This came out of Washington, D.C., and this was published on Monday the 22nd. The Centers for Disease Control and Prevention, the CDC, has agreed to add a disclaimer to the surveillance case definition for Lyme disease that it is, quote, not intended to be used by healthcare providers for making a clinical diagnosis or determining how to meet an individual's patient's health needs, end quote. I've been saying this on every single video I have, so thanks, CDC. Probably never hear those words out of my mouth. According to a July 16th letter from Dr. Lyle Peterson, director of the CDC's Division of Vector-Borne Diseases, this change is being implemented on, quote, all individual case definition pages, including the 2017 Lyme disease case definition page, end quote. This action was taken following an information quality request for correction complaint filed by the Patient-Centered Care Advocacy Group on May 20th, 2019. According to the complaint, many healthcare providers incorrectly rely on the case definition to interpret results of the two-tier tests, resulting in large numbers of patients who are misdiagnosed and denied medically necessary treatment and insurance coverage. This situation worsens the Lyme epidemic and increases the financial impact on our country in terms of lost productivity, disability, and increased medical expenses. Yeah, I'll comment on that later. I'll go back to that. A CDC disclaimer states, quote, a surveillance case definition is a set of uniform criteria used to define a disease for public health surveillance. Surveillance case definitions enable public health officials to classify and count cases consistently across reporting jurisdictions. Surveillance case definitions are not intended to be used by healthcare providers for making a clinical diagnosis or determining how to meet an individual patient's health needs, end quote. According to the case definition for Lyme disease, most patients must either have an arrhythmia migrans rash, an EM, also known as bullseye rash, or test positive on a two-tier blood test according to the narrow threshold. Yet, many patients never get this rash. It actually happens in less than 30% of patients. And a systemic meta-analysis of published data shows that the mean sensitivity of a two-tier test is only set to be 35.4% in its acute stage and 64.5% in the convalescent stage, with an overall sensitivity of 59.5%. The unreliability of the two-tier test is compounded by widespread misconception by healthcare providers and insurers that patients must test positive according to the surveillance criteria to confirm that they have a legitimate case of Lyme disease. I've been saying this for a while. The CDC has finally spit this out. The disclaimer is a step in the right direction, says Bruce Fries, president of Patient-Centered Care Advocacy Group, but a lot more needs to be done to educate healthcare providers that the two-tiered test is unreliable and the case definition should not be used for diagnosis. CDC has been encouraged by Congress as far back as 2002 to aggressively pursue and correct the misuse of the definition. Unfortunately, however, little was done, and the case definition continues to be misused. The following links to the complaint and here are the following links to the complaint and the CDC's response. I will post this link, as I always do, underneath in the description for you guys. Again, this comes from WebWire, and it does not list the author of this. So let me back up on a couple of things and comment on what was mentioned here. Sorry, this is Christie's brain thinking. I sing, I guess, as I think now. Okay. So when they're talking about a two-tiered test, you know, if you're not familiar, what are they referring to? Two-tiered testing is looking at doing an ELISA test and a Western blot, which is originally looking at more or less the same thing that we look at when we do a Western blot for AIDS. You know, does somebody test positive for having titers for specific markers that would cross-correlate to AIDS? So that's one piece of it. And then the second part, ELISA testing, would look at, okay, which bands do you show up positive for? So that's what that's referring to, in case you needed any clarification on that. Now, with this particular line here, this situation worsens the Lyme epidemic and increases the financial impact on our country in terms of lost productivity, disability, and increased medical expenses. So I've said this for a long time for myself. The amount of money, and I should go look up a statistic on this. I used to have exact data on this. The numbers are escaping me. But the amount of people that I know that are out on disability for Lyme and Lyme-related conditions, which are a multitude of different conditions, as we know, is quite a lot. So I always look at the financial burden this is causing people. Wouldn't you think it would make more sense to not have a bunch of people out on disability because they're not able to get appropriate treatment, they can't afford treatment, they're not getting better from the treatment they're getting, the testing is unreliable, on and on and on and on. How many of these people are actually out on disability and unable to be productive and be out in the workforce and contribute to society? How much money is this costing our government? You would think that amount of money that it's costing the government to have people out on disability, or medical bankruptcy. You know, let's just say people are declaring medical bankruptcy. There's somebody like myself who, full disclosure, with having Medicare, so, you know, this is with me having health insurance, has like 80 grand in medical, bills, in co-pays. It's insane. So I'm required to see so many specialists. That being said, have any of these specialists got me better? For the most part, no. My Lyme doctor is the one who usually, you know, puts me in a better spot, and or has put me in a better spot. And there are several other doctors that I do work with, but mostly the ones I practice with. So, you know, let's just say conservatively, if you include diseases like rheumatoid arthritis and multiple sclerosis and other diseases like lupus that have been linked to Lyme, or sarcoidosis, or other types of cardiac conditions that can be associated with Lyme, the amount of people that are out of disability for that is quite a lot, in addition to psychiatric illnesses that stem from neuropsychiatric Lyme. Now, I thought this was interesting. My local hospital that I am typically in, or wind up in, knock on wood somewhere, please, everybody. I'm knocking on my nightstand right now. Don't need to wind up there. Actually had an article on neurological Lyme the other day, so I was kind of surprised to see that. So, I mean, it's being looked at. What are the neuropsychological effects of Lyme? So, think about how many people are on a disability because of underreported things with Lyme disease there, or you have children who are severely or profoundly autistic where Lyme has been linked to that, or PANDAS cases, or something similar to that. So there's a lot of different reasons why I would think there's such a large population of people with those diseases collectively, or suffer from mental health problems, or coupled with both, that may be out on disability. That is a lot of money our country is wasting, or government is wasting, on doing when they're not doing something about it. So it makes sense to come out with something like this. That uniform criteria needs to be changed. Another thing that's interesting too is that there are more than one type of Lyme disease bacterium. So keeping that in mind and not even just looking at co-infections like things that are parasitic or fungal in nature or other things like Barter babesia, and stuff like that. If you're not paying attention to that, you're not going to get yourself better. So, it's a multi-systemic approach when it comes to Lyme, and that really needs to be addressed. So I think that that's important. This is a great article. We'll go ahead and post this. Lyme has been getting a lot of publicity. Like I said, a lot of publicity lately. This resonated with me. This comes from The Mighty, which is a really great blog for people who are struggling from chronic health problems. So even if you don't have Lyme, I highly recommend checking out The Mighty. It's really great. You'll see every now and again I like to also write for them as well. So you'll see a couple of my articles posted here. This is by a young lady by Christie Korth. This was actually published a little while back, but somebody had gone ahead and republished it. I thought this was important. So it says, The Lonely Battle of a Lyme Warrior. I can resonate with that. Let me keep going. Kimmy writes, The alarm wakes me up from a deep world of sleep. I so wish that happened to me. Just kidding. Hang on. Dreams still floating on the surface, but instead of moaning about the morning and the tasks that lie ahead, I'm immobilized in bed, burning pain fusing my back to the mattress, eyes sealed with stitches of exhaustion. As an author, that's like, for me, that's just like a beautiful line, even though it's displaying so much pain, but I love the way she wrote that. So true. Lyme disease means facing a concoction of symptoms on a daily basis, like the unbearable tiredness sinking its deep teeth into your bones, or the brain fluttering with a confusion of words while pain rips through your muscles. A new day means another 12 hours of wading through thick currents, if you can make it that far. There is no respite from Borrelia, that's a co-infection, that's the bacterium, the Lyme-causing bacteria, only in the shape of tablets and hope. And even then, it can come back. Let me continue reading on here as Kimmy continues to keep going. Sure, fighting this illness makes you strong. I can attest to that. Southpaw me. But the truth is, you would too. You have no choice, no time out. It is relentless. You're effectively being tested on a daily basis, and most of us become good at coping and inquisitively good at hiding. That's an interesting one I'll bring up. So good, in fact, that we begin to live two separate lives. One in which the disease impregnates everything we do, and the other where we pretend everything is okay, it's just fine. This is a Lyme warrior. Amen, girl. We are not super beings fighting off adversity, which is, I joke around why I have my Supergirl tattoo. That's my alter ego when I'm fighting Lyme disease, or when I'm running, because it talks about flying. Anyway, we are not super beings fighting off adversity, but instead people with well-rehearsed coping mechanisms, and subsequently great actors in our daily lives. I've said this for years. I'm a great actress. How are you doing? Oh, everything's better than good. Oh, you look great today. Thanks. Nobody has any idea what I went through that morning or later that day. It's just I keep that behind closed doors most of the time. I don't share. Thing is, very few people know, except maybe the ones living around you. That is so true. The people that live in my house know what I go through. But even then, concealment puts a smile on your face. Rather smile than cry, so I agree with this. A clue, however, lies in our absence. Fighting this chronic battle isolates you from the world. You may no longer be able to socialize with friends, do the sports you once enjoyed, or even work. Instead, you focus on surviving, stumbling through the minefield of symptoms and exhaustion. What's left of you is sapped into the normal, into fitting in. Even doctors sometimes fall into our traps, but you look fine. Okay. And thus a new day begins as our wield of swords alone in our minds, hoping to get through another day. Kimmy Stewart, great job on writing this article. This was beautifully written and just depicts exactly what I feel like most of us do go through. This really struck a chord with me, I have to say, reading this, because it is true. We do kind of live like, I at least at the Lyme patients and colleagues and things that I've spoken with kind of do live this alter ego where you know, listen, nobody wants to hear you complain all the time. Let's just get real about that. Um, you know, I had a family member today ask me, it's like, oh, how are you feeling? I'm okay right now, you know, is my response, because I don't want to go into the 900 things that have gone on with me in the past few days. Or just the precautions that I have to take in order just to do things, or the disclaimer I always say that I have to use before I hang out with somebody. It's like, oh, I really want to hang out with you, but if I can't, please don't get upset. This gets further complicated when you have children, especially when I'm setting up. My son does not like when I call them play dates anymore. Setting up hangout dates for my son. Most of my friends and family, neighbors, you know, people are very understanding, but there have been many times where I've had to cancel at the last minute or reschedule or postpone activities, and I try not to tell my son we're doing anything a lot of times to the last minute, only because I don't want to disappoint him, one. But two, I'll use this disclaimer. If I'm not able to hang out, because I don't want to, it's because I'm physically incapable of doing it at that particular moment. Fortunately, like I said, most of the people in my life are understanding, but I've had a lot of instances where people aren't. I've had a lot of instances where people actually stop speaking to me as a result of it, because they're just like, oh, is she just being lazy? Anybody that knows me knows I'm the furthest from lazy ever. I have always worked, and I've worked full-time all throughout college, and went to school full-time as well. Put myself through college, paid for it, had a job since I was like 12, unless you count when I was like 8 and I had a lemonade stand and I was like really super serious about it. But I think it's interesting that, you know, somebody that's so hardworking, I went on to start my private practice and worked 3 jobs. Having a private practice, having a corporate position in nutrition for a large company, in addition to writing my first book, in addition to being a single mother on top of that. Talk about Supergirl, you know, I mean, I definitely didn't back down, you know, so it was a lot of things that I would do. When I got sick, though, it was like, poof, pop, you know, everything kind of just stopped back in 2013 for me, and I've struggled since then. You know, I will get better for a period of time, go into remission, things happen, and, you know, my life has definitely changed. Let me just leave it at that. Am I ungrateful for the fact that I'm here? I'm sure. I'm certainly grateful for the fact that I'm still here and that I'm able to be with my son and so forth. At the same time, it gets very lonely. It gets very socially isolating. Some of the things I'm talking to some colleagues and some other Lyme sufferers about is setting up community for people with Lyme. I'll get more into that. We're going to do an interview with another fellow Limey sometime in the next week or two. And we'll talk about that really cool idea that we have, because that would help with social isolation. And it would also help with some of the other issues that we Lyme struggle with. So I'm really excited about that, and it's something we're looking to launch hopefully soon. But yeah, no, and then the other trap that this talks about, you look fine. Okay, outside of me looking like a lobster right now, and kind of matching the color of my really cute purple dress. Yeah, let me tell you how frustrating that is. That's like a whole other Oprah show. Listen, I don't want to walk into anywhere looking sick. If I had pictures of myself when I was first hospitalized back in 2013 for the Lyme meningitis, I had a dear friend of mine comment that I looked like a concentration camp survivor, because I had lost so much weight. My face was sunken in. Obviously, pregnant me, you can't tell right now. Fortunately, I've gained a fair amount of weight to support my unborn daughter. However, at the same time, prior to me going on certain medications back in late 16, I was 90 pounds soaking wet. I had a conversation with my mother the other day that was like, you were just so skinny, I couldn't even look at you. I had people comment, are you anorexic? I felt very, very isolated, very alone. But your disabilities are on, and at that time, you know, was in and out of a wheelchair with on and off a Foley catheter, so I absolutely looked like, yeah, there's something wrong with her. Now, if you see me floating around, outside of me looking like a lobster, you know, you really can't tell anything's wrong with me on the outside. But I had gone and taken my son with family the other day to the aquarium. And I'm going to pull this picture up because I thought this was cool. And I had gone ahead and used, I have a handicap pass. So I used my handicap pass when I went in. Listen, I'm out on disability. So if I can get a discount when I go out someplace, you know, I really, really appreciate that. So I do utilize it when necessary, and then I donate money to causes when I can. So I try to, curtail it. But the young lady behind the counter turned around and she asked me, she's like, well, what's wrong with you? Being pregnant, she said to me, is not a disability. Yeah, honey, I'm very well aware of that. I've been pregnant 3 times in my life. I certainly understand that pregnancy is absolutely not a disability. Shoot, if I didn't have Lyme disease, I'd still be running right now with the other things that I have going on. That being the case, even being pregnant, I was very active with both of my prior pregnancies. That being said, I found that to be a really rude comment. But, she was just ignorant, and I really just didn't take it to heart, because, these things happen. Understandably so. So there's a little comic here it's really cute. Let me see if I can try to pull this up in a bigger mode here so you guys can see this better. And I can, somehow or another, let me see if I can flip this. Oh, my camera doesn't like to let me flip things. There has to be a way to do this. It's bugging me.